right, y'all, part two. Things to look out for when you're seeking your plastic surgeon. I'm Dr. Maka. I'm a board certified plastic surgeon. We talked in part one about board certification. We talked about making sure that the privileges to do what's done at an outpatient surgery center like I am now match the privileges that that surgeon has at the hospital. That's like the secret sauce of determining, like, okay, is this legitimate? Because there is so much happening out there. I call it now the Wild Wild West of plastic surgery. There is so much happening out there, y'all. Okay, so part two, let's talk about this. So think about the surgery itself, complications. What happens if there's a complication, right? Like, what's the protocol for a complication? Who do I have to reach out to if there's a problem, right? Am I going to have trouble reaching somebody if it's after hours? Those are all important questions, because what you have to think about is, obviously, the majority of the time, surgery goes well, there's no problems. But the reality is that if you're doing surgery, right, as a surgeon, occasionally you're going to have some complications. Occasionally you're going to have some people that maybe need revisions because maybe things didn't heal how we had hoped it would heal, right? So that's an important process, because I have been in situations where I've been called as a plastic surgeon on call for a major hospital here in Nashville to see patients after surgery who had surgery somewhere else and they couldn't reach anybody after. Like, literally, they were stranded. You do not want that to be you. That is a horrible situation to be in. And when I go and talk to these patients, they're not as upset about their complication as they are about the fact that they couldn't reach anybody. You don't want that to be you. Now, the other thing to think about on that same note is revision policy. Like, what happens if things don't heal how we expected them to heal? In an ideal world, plastic surgery will be perfect. Everything will heal perfectly. But I always tell people, we're not seeking perfection. We're seeking improvement, right? Now, on that same note, what if things don't heal how we expected? What if the incision doesn't fall how we expected? Maybe the incision is more raised than we expected, or maybe there's a little fat pocket that's sort of more evident than we want it to be. What happens, right? What is the procedure then? The only question that is not a good question is the question you don't ask. So that's the second thing to look out for. The next thing I think is to ask, who is involved in my care, right? Like, who are the individuals that are going to be involved in my care? I'm a plastic surgeon, but I have an entire team because I can't do it all alone, right? And that's important, because if you can't reach me, if I'm in surgery, you can reach someone from my team who is very well equipped in this and who can help you navigate any issues. And it may not even be that you have an issue. It may just be that you need reassurance, which is what happens, honestly, 95% of the time. It's just reassurance. We're your coaches because you've never done this before, so how would you know what to expect or what to do? Right. The other thing to think about, before and afters. Not only just looking at before and afters, ask for before and afters that look like you. Like, does the patient have the same skin type as you? Like, how do these people healing? Like, does the patient have similar body habits to you? Ask for that. It may be that it's not on the website, but it's something that they can show you so you can feel assured that, okay, these are the realistic results that I can expect for someone of my body type, the scarring, the healing, things like that. Ask what happens, what do we do for healing post-surgery, right? Because when you think about plastic surgery, and really any surgery and recovery, should be very holistic. It shouldn't just be about doing the surgery, getting out, getting in. What are we doing to support that recovery? Are we doing anything for the scar? Are we doing anything from a vitamin standpoint to help with the healing and the recovery? Like, that kind of thing, it all matters because it's all holistic. It's not just about surgery. Surgery is maybe 40% of the equation. 60% is what are we doing after and before to prepare ourselves in terms of healing. And then the final and fifth, surgery, recovery, and processes and techniques. If you feel like you need, for example, liposuction and you're recommended not to have it, maybe ask why, right? If you meet with a surgeon like me who does a drainless technique, you can ask, why drainless? How is it different? How does it work? I've explained that so many times on here, and patients often ask me that as well. Keep in mind, this is your body. It's your life. You have the right to ask these questions, and they're important questions. A little bonus I'm going to give y'all is this. If you're wondering about board certification, the issue is if someone's not board certified in plastic surgery, they're still going to have board certified on their website, because they'll just say, I'm board certified. And it's kind of a route of deception in a way, and you won't be able to know. So here's two things you can do. You can go to the American Board of Plastic Surgery website. That's ABPS, American Board of Plastic Surgery website. You can also go to the American Board of Medical Specialties. If you go to these websites, you can type in the surgeon's name, and literally it will show you if the certification exists and if it is active. The board of, for example, cosmetic surgery is actually not a recognized board by the American Board of Medical Specialties, so you won't see it. You may actually see that that doctor is certified in maybe OB-GYN, maybe pediatrics, maybe internal medicine, and you won't see plastic surgery, and that will tell you that what you're working with, whose hands you're putting your life into. Just some hints, y'all. This is very thorough. If you're just seeing this part two, I would recommend you go back and look at part one. It's just going to help you in your journey to seeking a plastic surgeon if this is something that you have thought about and are interested in. All right, God bless y'all. Catch y'all later.